Yeah, hello, dear people. This is Dr. Artour Rakhimov, and my name is Volker Schmitz. We have here a new part of our series where we discuss different topics in relation to breathing retraining, especially the breathing retraining of the famous Dr. Buteyko. And now sometimes we get the question, you even more than me, about the Wim Hof method, which is the application of cold, and they do some breathing exercises. And is there a relation to the Buteyko method? And I get this question also. So, well, yeah, what do you think about it?
Yeah, I had many questions and comments on my website, normalbriefing.com, from students, from like people who visit the website, asking like, okay, Wim Hof, and he's like, his method is well known, a lot of people practice it, and what he does before submerging in cold water, he hyperventilates, asks people to breathe more. And so, whereas Dr. Buteyko teaches that people need to breathe slower and less air, so what kind of, it looks like totally opposite ideas, totally opposite directions in relation to breathing. And the answer that I suggested and explained, I made even a separate web page about this because people were asking what is Wim Hof, why it is different from Buteyko. I made a web page where I explained that Dr. Buteyko method relates to the way people breathe day and night. So our autonomic, unconscious, automatic breathing during sleep, for example. And the purpose of the Buteyko breathing technique is to provide better blood supply and to improve oxygenation by changing our breathing, by slowing down our breathing. Because according to hundreds of medical studies, there are several physiological facts which we can find out. And one physiological fact is that people breathe too much these days. People breathe on average twice more than the norm, and that relates to more than 99% of modern population. So people breathe 12 liters instead of medical norm 6. That was established 100 years ago. And because of that, people have smaller results for the body oxygen test, for the CP test. So that's one fact. Another fact is when people hyperventilate, we breathe too much, is that we get less oxygen. Less oxygen in the brain, heart, all other vital organs would have reduced oxygen content in the cells and tissues of these organs. And therefore, it makes sense that Dr. Buteyko, when he started to develop his technique and later had thousands of people who restored their health completely, including people with severe cases, like let's say complications of diabetes, people with cancer, heart disease, and so on. He found that people, if they manage to restore their breathing, then they are able to get rid of symptoms and medication and have excellent lifestyle, excellent quality of life, and lifestyle changes dramatically. And so that's because of that, the Buteyko technique is about breathing retraining, so changing in our automatic unconscious breathing. Whereas the Wim Hof method, and many free divers, we also hyperventilate in order to get a better result, to get a longer dive or longer breath hold, if there is a contest, like for how many minutes, seconds a person is able to hold breath. I remember myself.
They even have two disciplines, one with hyperventilation and one without.
Makes total sense, because
even with
difference
oxygen,
is very, very large for all these situations.
And this is very dangerous, by the way, so don't do it alone, or better, don't do it at all.
It depends on the person, exactly situation, but among free divers, it's known like black death, they call it blackout, like various abnormal situations possible just due to hyperventilation alone. So what Wim Hof technique here relates to, people just do hyperventilation, deliberate hyperventilation, in order to extend their breath holding. So it's kind of a temporary method technique which is applied, and later they hold their breath, so they accumulate CO2. So here, this effect relates to Wim Hof training and breathing exercise. In my view, there is a huge positive effect of Wim Hof training related to adaptation to cold. And that is a part of the Buteyko technique in this way, because Dr. Buteyko, I made videos him swimming in snow, very old, poor quality, very old videos, but you can see that it was actually real Dr. Buteyko. With snow, in winter time, you can see a lot of snow, I don't know, December, January, somewhere. But it's known also that as he trained, and among other Buteyko doctors in Russia, I remember that they wrote that final goal of this cold adaptation techniques for the Buteyko method. We wrote that somewhere in Siberia, when it's let's say minus 20, minus 30 degrees, what you should do, you are in your pants and you take a pile of ice cold water outside, pour it on yourself, and go like running half an hour, 1 hour, like semi-naked. This is what Buteyko doctors wrote in some of the literature. So
I didn't know that.
Yeah,
I will try tomorrow.
It's really kind of extreme, but this is what we thought. I found it's true that when people really achieve really high levels for VCP test, we start to enjoy cold much more, and we crave cold. We find it so enjoyable and natural to use.
But no, it's a lot of fun. We actually did it a few times, like ice bathing and so. But still, if you do it, it's a lot of fun. Yes, but the moment itself may be really cold.
But it's also true, like when people have lower CP, they hyperventilate. Of course, there are
dangerous.
Two things here. One of them is, of course, it's with CP less than 20 seconds, people should not use it. And I have a separate page about restrictions and contraindications and kind of preliminary factors which are important for people to apply in order to get all benefits, because first of all it can be very dangerous, and this is what Soviet doctors and Dr. Buteyko described.
Because there is an impulse if the water is very cold, there will be an impulse, an impact that you want to hyperventilate, and often people cannot resist this impact. This can be very huge, and if you are underwater, it would be really dangerous, because then you would swallow or breathe in air, and
there are two different effects actually, and that is the second effect. That means that particularly at the early stages, maybe later people are kind of more adapted. At the early stages, it's important to have a gradual transition to cold.
Yes, better.
When taking cold shower, and we have it on the page as well. So, for example, when taking cold shower, take one arm, another arm, one leg, go higher, 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 and that allows people to have more slow, gradual transition from being warm to being cold. So that's one part. But there is another part which I believe can be for a certain group of people much more dangerous, in terms of we should not apply any cold procedures at all. And that relates to people who have less than 20 seconds
CP,
for the body oxygen test. Because in Russia, after testing thousands of their patients, Buteyko found that when people are sick, severely sick, we have 10-15 seconds CP, which is very common. We see all the time in our students. For them to use cold shower is not a good idea at all, because I would say
they can catch a cold or what.
Probably more than 90%, more than 95%. I had few cases of such people. They would just tell me about the experience, because in my questionnaire when I start to work with students, I ask them, did you try cold shower? Do you take cold shower now? And few people I remember would tell me, I tried cold shower, but I get infection, which makes total sense, because with CP 10-15 seconds, when people hyperventilate, the immune system just too weak, and we get respiratory infection virtually like next night, next day, we already know it's totally blocked. Very, very fast negative effects. Whereas, as Dr. Buteyko found, and this is what we teach to our students, when we are at the better health state, they get more than 20 seconds for the body oxygen test. Using cold shower would be a very useful practical step in order to progress further for the students. And I never tried actually to swim in ice cold water, but it's
very good. The effect is very strong. But
ice cold
shower. Of course, we prepare ourselves a lot before that, with showering for maybe even years or at least months, and building up a lot of brown fat cells and large CPs, of course.
It helps. Long-term effects would be adaptation to cold and brown fats.
Do you think the Wim Hof method is potentially dangerous, or?
No, again, what I mentioned here is that certain groups of people who are sick, severely sick, with less than 20 seconds for the body oxygen test, any cold procedures would be not suitable for them. They would most likely to get infection. Although I had in my practice few people, not many, who were doing this cold adaptation for a very long time, and even though we had 15 seconds about CP test, we were still fine with having ice cold shower even every day. But that would be again exceptions, like for some reasons people manage to adapt to it. Most people will not be able to. But generally, Wim Hof method, like going back to the equation, of course, I believe it's very beneficial, and it's even hard.
Even hyperventilate one time or two times before they go into...
This is, again, like, it's not the purpose of his technique to retrain breathing, and he does not say anywhere in his preparation or his goal is to retrain breath in people, because this is what we do, like Buteyko breathing teacher, maybe people who teach like Frolov device, few other people, but in his technique called adaptation is the main purpose, and that more relates to adaptation of the body in terms of production or regeneration of brown fat cells, because brown fat cells, as we know, is exceptionally important part of the healthy immune system. Like humans, when we are born, we have a lot of, somewhere around 8-10% or more of all our fat cells, not white cells, but brown fat cells with a lot of mitochondria, blood flow, able to generate heat without any support, like just within themselves. And polar bears, animals who live on ice, they would have also much more brown fat cells because they can be mobile, lying on ice at very cold temperature. And without movements, why they generate heat? By the brown fat cells. And human babies as well, they generate a lot of brown fat cells. We are very well adapted to cold conditions. But when we are not exposed for many months or years to cold at all, and a lot of people, sometimes maybe they have too warm conditions in some countries, but in other places they just wear too warm clothes, they spend too little time outside, and brown fat cells completely disappears. So these days, like if you go online, you can find literally there are thousands of studies and dozens of leading team of scientists around the world trying to invent drugs, how to regenerate, build brown fat cells in the human body. But human body is already born with brown fat cells, so all we need to maintain it or to resume it later to have this cold exposure, which allows people to regenerate brown fat cells. And then, according to research, it helps to prevent such conditions as cancer, heart disease, diabetes, like metabolic conditions, very powerful effect on them. That's the reason why we spend probably millions now in order to find the drugs to how to regenerate or produce brown fat cells.
And from our perspective, it also gives better breathing, of course.
Of course, yeah. When
immediately
teaching the course, this is
will be enhanced.
What I teach is, and if we do it like 2-3 times a day, it's about the same effect as one breathing session. If you do it like 2-3 times a day for a long enough time, like good cold shower, very powerful effect on breathing retraining.